Hello, everyone, and welcome. And thank you for joining us live. To those listening in afterwards, I would also like to warmly welcome our guests today, whom I'll introduce shortly. Our webinar today is titled Improving Collaborative Care, Strengthening Inter and Interprofessional Relationships. This digital event explores strategies for improving communication and collaboration between pharmacists, pharmacy technicians, and other healthcare professionals. You will learn best practices for interprofessional interactions and improving intra-professional relationships to optimize patient care. We will also highlight the FIP's efforts to promote interprofessional collaborative practice, defined by the WHO as multiple healthcare professionals from different backgrounds working together with patients and communities to improve the highest quality of care. This webinar will provide valuable tools for improving teamwork and fostering a more cohesive healthcare environment. Next slide, please. My name is Cathy Schuster, and I've been a pharmacy technician for just over 50 years in many pharmacy and educational settings. I am currently the Pharmacy Technician Coordinator for the Canadian Council for Accreditation of Pharmacy Programs. I joined FIP in 2015, and I am a member of the Pharmacy Technician Advisory Committee. Next slide, please. As you can see from this slide, we have many announcements. Please note this event will be recorded, live streamed on FIP YouTube, and the recording will be available at events.fip.org. To all those listening, please feel free to send your questions through a Q&A box, not the chat box, provided, and I will do my best to manage all the questions. You are welcome to provide feedback to webinars@fip.org. I would like to take this opportunity to promote the benefits of membership with FIP, including events and webinars. FIP is the global body representing over 4 million pharmacists, pharmaceutical scientists, and members of the pharmacy support workforce. If you'd like to become a member, please register on FIP's website at fip.org. Next slide, please. This digital event is supported by unrestricted funding from Reckitt. Next slide, please. For this event, we are joined by a panel of fabulous speakers, and I wanted to sincerely thank each of them for taking the time to prepare their presentations. Today's agenda includes a welcome and introductions by me, your moderator, improving patient care, embracing inter and intra-professional collaborative practices across the healthcare team by Nikki Rogers, building bridges, promoting inter and interprofessional education for improved healthcare collaboration by Jill Martin-Boone, and the role of FIP in promoting interprofessional collaboration to improve patient outcomes and quality of care by Luis Lorenzo. We'll have a Q&A session, and then we'll do a wrap-up and a conclusion. Next slide, please. Today's learning objectives are to understand the importance of inter and interprofessional collaborative practice in the delivery of high-quality patient care in all healthcare settings, to explore communication strategies and best practice to improve collaboration between pharmacists, pharmacy technicians, and other healthcare professionals, to discover the importance of intra and interprofessional education in improving teamwork among healthcare professionals, and explore practical strategies to enhance such educational efforts in healthcare settings. And finally, to understand the role of FIP in promoting and advancing interprofessional collaborative practice worldwide. Next slide, please. It gives me great pleasure to introduce Nikki Rogers. Nikki has been a pharmacy technician for 13 years, spending 10 years working in inpatient pharmacy at the University of Alberta Hospital before moving to the provincial pharmacy team with Alberta Health Sciences. She has been fortunate to experience many years of pharmacy, including chemotherapy, stability studies, and clinical pharmacy. Please welcome Nikki. Go ahead, Nikki.
Thank you, Cathy, for the introduction. I'm here today to talk about my own lived experience with inter and intraprofessional relationships in my work as a pharmacy technician. The first 10 years of my career was spent working at the University of Alberta Hospital, as Cathy mentioned. This hospital is one of the largest in our province, and it is unique as it provides care for neonatal, pediatric, and adult patients, as well as chemotherapy treatment, and totals almost 1,000 patient beds. Pharmacy technicians are given the opportunity to mix chemotherapy and work in clinical locations such as the pre-admission clinic and the emergency department, which provides opportunities for intra-professional collaboration. When mixing chemotherapy, pharmacy technicians work side by side with the pharmacist to ensure that the patient receives their medication in a safe and timely manner. The pharmacist and the technician are in the IV room together for the preparation of these medications. The technician does all of the setup, pulls the drug and the labels, and mixes the compound, while the pharmacist does the volume checks, verifies the protocol, and packages and labels the final product. We also need to collaborate with the unit or the outpatient clinic to ensure that the medications get up on time, to make sure that the outpatients have arrived at the clinic before we begin preparation, and to communicate any changes in the treatment plan. While working in the pre-admission clinic, pharmacy technicians are speaking with patients to go over the medications that they're currently taking and to fill out a best possible medication history, or a BPMH. While in this clinic, I had the opportunity to collaborate with nurses and anesthesiologists to make sure that the patient is prepared and cleared for surgery. Having pharmacy technicians there go over the medication history with the patient takes that load off of nursing and physicians, which is beneficial for their time and for well-rounded care for the patients. My current position with Provincial Pharmacy Services includes working closely with other pharmacy teams, as well as the pharmacists that work on my own team. Our job is to ensure that the quality and accuracy of these recipes for sterile and non-sterile and repackaged products. The pharmacy technician's role is to create the recipe, ensure that it contains the right ingredients and directions, and is up to the provincial and federal standards. The pharmacist will then investigate the stability studies to determine the beyond use dating, or the BUD, for these sterile and non-sterile products, and verify therapeutic appropriateness before sending it back to the technician for a final audit. Together, this ensures that the recipes are accurate and easy to follow for the sites in the province to provide medication to our patients. We need both pharmacists and pharmacy technicians to be part of this process because of the different views that our professional expertise offers. We need the pharmacists for their knowledge of therapeutic appropriateness, contraindications, and clinical experience. And we need the technicians to bring the compounding lens, understand what equipment is needed, and to provide general mixing guidelines. We also work quite closely with other provincial pharmacy teams, such as the technical practice leaders, or the TPLs, on many different projects. Currently, I am working with the pharmacy technicians on that TPL team to mix sterile medications that do not currently have any stability data. We then collaborate with the laboratory to do testing on these products and write up reports to publish our findings for future hospitals to use in their own references. This project currently requires the collaboration of the lab, the pharmacy technicians on these different teams, and the pharmacists to apply this beyond use dating to our current and future recipes. This is beneficial for all involved as it applies data where none was previously available. At the end of the day, the goal of a healthcare team is to provide the best care possible for our patients. In my experience, different designations of healthcare professionals do want to come together to help each other reach this goal. Over the years, I have learned many different things that can help or hinder these professional relationships. The main thing that will provide a strong foundation is communication and having an open mind. Whether it is other technicians, pharmacists, or nurses, we all have valuable information to offer and an opportunity to learn from each other. When people can compromise and discuss amongst each other, everyone benefits, especially the patient. Pharmacy technicians in Alberta have seen a large growth for their scope of practice over the last decade, and sometimes it's hard for us to find our voice in this new expanded role. It has been helpful for me to remember in those moments that pharmacy technicians provide a unique perspective in the same way that pharmacists, nurses, or physicians do, and that our colleagues value the knowledge that we can provide. It helps to come prepared with information to share with your team. Alberta Health Services has been rolling out a new technology in their provincial sites called Epic, and this has led to a lot of learning curves and a need to collaborate. Epic is a system that all hospital staff, from nursing to physicians to pharmacy, use in their daily work. This system ensures that a patient's file is linked and accessible no matter which healthcare facility they go to. Their care will be consistent. Their medications are compounded the same way. Nurses and physicians document everything. A full picture health history will follow the patient. I was part of a working group to facilitate how pharmacy technicians were going to mix chemotherapy using this new computer system instead of our historical paper worksheets. This working group included pharmacists from cancer care, health professionals from medication quality and safety, and staff from human factors to ensure that no steps were missed. I was fortunate to have already used this system to mix IV chemotherapy products, and I knew that others in the working group had never seen what could be done with this new technology. I presented a slideshow with screenshots of the new system so that everyone in the group could see what the capabilities were. And from there, we could all discuss a way forward. I find that it is much easier to get people to see all sides when they understand what is being presented to them. This, in the end, leads to patient safety and well-rounded healthcare. One area that I found to have the most interprofessional relationships was working in the pre-admission clinic. This clinic is where patients would go before their surgery so that the healthcare team could explain and prepare the patient in advance. Collaborating with the physicians and nurses really shows how this kind of teamwork can benefit all aspects of care. By having the pharmacy technician discuss and document medication history with the patient, the nurses now had more time to explain the procedure and aftercare. Pharmacy technicians know to ask about medications that are over the counter, such as aspirin, that can then be flagged to the physician to discontinue prior to their surgery. We can also communicate when a patient has stopped medications that may affect pre and post-operation care, such as controlled substances or diabetic medication. Of course, directly in the hospital pharmacy is where I saw the most intra-professional collaboration. The University of Alberta Hospital has a pharmacy team of over 200 professionals, including pharmacists, technicians, and assistants. Our pharmacists are responsible for clinical work and directly collaborate with the patients, as well as verifying physician orders and checking chemotherapy. Our technicians take the lead on mixing and sterile and non-sterile medications, and we rely heavily on our pharmacy assistants to help us repackage medication, deliver stat medications, and refill Pyxis machines. The teamwork between each of these pharmacy professionals provides invaluable support for the hospital to help the pharmacy process run smoothly. A lot of time, the biggest challenges come from a lack of education. People don't know what they don't know. This can often lead to frustration and a lack of communication when the other side does not have the full understanding. For example, working in inpatient pharmacy, we get requests for past medications so that patients can go home for weekends or holidays, or to supply medication while a patient is being transferred to another facility. Alberta law requires that a physician must sign any past medication order for a controlled substance. Often, nursing will not know this, and they'll send the order down without a signature. This can then delay the patient from going home if the pharmacy must then contact the unit for a signature, then nursing has to contact the physician, and so on. More education to the unit would be an easy solution to this delay. Simple things like physical barriers can also become an issue. While mixing chemotherapy for the outpatient oncology clinic, the pharmacy technician starts out in the IV room alone. They then have to call out for the pharmacist to come in for a check on their preparation, and sometimes we're not aware if the pharmacist has stepped out to speak with a nurse about a medication dose. Being in a room by yourself, you're not really aware of what's happening outside your room. Getting our new technology helped a lot with this. Now with our Epic system, technicians can take photos of their preparation to send electronically to the pharmacist, and we can also communicate back and forth on a messaging system to keep each other informed. The barrier that I personally am most sensitive to is strong personalities or a lot of pushback. It is easy to feel discouraged or downcast when other team members have strong opinions against what you are suggesting. Especially when working through a new workflow or technology, it is best to remember that everyone is trying to be hard on the process, not the people. I sit on a chemotherapy working group, and cancer care is a very thorough area of pharmacy. It is very easy for people to get attached to our old processes, and we all know that change is hard, especially when you're comfortable with the current way that things are going. This is a situation where I find it very helpful to come prepared to discuss your side of things. Sometimes it helps to speak to team members in smaller groups to explain and discuss things with a little bit less pressure. Having more people that understand the changes that need to be implemented can help with communication to the larger group. Working on a provincial pharmacy services team requires a shift in the way that you think about your work. When I came to my current team from a frontline position, it was quite difficult for me to start thinking about how our work affects every site in our province instead of just the site that I came from. I find that this is a challenge that comes up most often when working with different working groups and areas of pharmacy professionals, especially when having a system like Epic, where everything in our province has to be linked. It requires a lot of compromise from different hospitals to come to a consensus that works for every site. These intra and interprofessional relationships require a lot of teamwork, patience, and communication, and create a complete scope of healthcare practice for our patients. I want to thank you all very much for this opportunity to speak today, and I'm excited to hear from the rest of the speakers.
Well, thank you so much, Nikki. That was very informative, and sometimes it's hard to understand that we do have to have that communication with all aspects of the pharmacy team, plus the healthcare professionals that we see every day in our workplace. Thank you again so much. Next slide, please. It gives me great pleasure to introduce our next speaker, Jill Martin-Boone. Jill is a professor of pharmacy practice, director of interprofessional education, and interim chair of pharmacy practice and administrative sciences at the University of Cincinnati Winkle College of Pharmacy. Dr. Boone is past president of ASHP, past co-president of the FIP Working Group on Collaborative Practice, and currently serves as the FIP Work Development Hub Director and lead for interprofessional education. A very warm welcome, Jill.
Thank you. Thank you very much for inviting me to be a part of this panel. I can sense that our other speakers, as well as I hope many participants, have a passion for developing improved interprofessional collaborative practice. And I have the privilege of talking about some of the foundations in order to improve our interprofessional and intra-professional collaborative practice. So just to start, something that many of you are familiar with, I wanted to start with the definition of interprofessional education, which is when students, and this can also include practitioners, from two or more professions learn about, from, and with each other to enable effective collaboration and improve health outcomes. Now, again, I'm sure many of you heard this definition many times, but I want to take a few seconds to really emphasize the about, from, and with, because about is something that's really critical. And Nikki really highlighted it beautifully a few minutes ago about knowing what the training, the expertise, the background, the ability of your colleague can be in a particular situation. So I need to take the effort to learn about my colleague. Secondly, hopefully the same, right? My colleague needs to learn about what I bring to the table. So we need to learn about and from. There's expertise that people bring to the table that we don't have. So we are listening and learning, and that has to go two ways. So about, from, and with. So as we're developing systems to better provide medication safety, we learn different ways that we can work with each other, new therapeutic ideas, how to best deliver them, new communication techniques. We learn together with each other. So education really has to be an active, interactive experience. Now, we also know that there have been competencies identified specifically for these skills in order to improve interprofessional practice. So we do know that every profession has individual professional competencies. Again, with pharmacy, we have medication expertise, we have process expertise in getting the right medicine to the right patient. We have expertise in regards to side effects, monitoring. We also do blood pressures and glucose checks and some clinical assessments. Well, in common competencies, so do some of our colleagues that are nurses or physicians also do some of these very same things. So there's an overlap. But importantly, a separate group of competencies that have been identified are the interprofessional skill sets. So that we know that there are skills that are needed to be able to play well in the sandbox. There are a number of competency sets out there. Australia has developed some, Japan has developed some. So there are many that are out there, but I give you an example from the US, which is called the IPEC competencies, which really highlight skill sets in values and ethics, being able to work with mutual respect, understanding roles and responsibilities, being able to communicate appropriately among the different disciplines, different professions, and then teams and teamwork, understanding the inner workings of a team and how to be a member of that. So I spend these few minutes because I think it's really important to understand the foundations as we talk about strategies for moving forward in building collaboration. The World Health Organization has already recognized the importance of interprofessional education. And looking at this diagram, you'll see right in the middle, it talks about the critical necessity of making a healthcare workforce into a collaborative practice-ready workforce. And so backing that up, we see that we currently have still in many, many places a fragmented system, which to a great degree is impacted by our lack of communication with each other, lack of teamwork, things getting dropped, things getting missed. And so as we can work together to become a much more cohesive, effective, collaborative group, we will ultimately improve care for our patients. And it's easy to see that we all have this same goal, but foundationally, we really need to improve our ability to work together. So each program, by the mere fact that there's a very sophisticated expertise, tends to train within silos. So we have silos of pharmacy schools, pharmacy technician programs. We have nursing schools, physician assistant schools, and we all tend to develop our training in silos. Slowly over the last few decades, we're recognizing that this actually further drives a break in the system. And more it's recognized that we need to have bridges across those programs, across those students, across those practitioners. And note on these particular silos, the bridges are on top. And for me, this is significant because we need to be incorporating people at the top of their profession, but having a very strong bridge that connects the ability for people to work together. So when we're talking about building bridges, I wanted to hit 5 strategies that I think are really important for developing collaborative relationships. Now, these strategies are a combination, much like Nikki referred to, of both my experiences as well as some literature, which I have references on the slides. And I think they're critically important as we talk about it. Now, there's many more, but these are 5 that I'd like to discuss today. So first of all, it's very practical, and that is when you have now recognized that there's an importance in interprofessional collaborative practice, and you know that you need to have partners. One of the key ways to start is networking. identifying people who you think might be like-minded, visiting them, running into them at academic events or faculty meetings or professional events, inviting interprofessional colleagues to come do a presentation, to serve on a committee, get to know them, develop that understanding about what they do. Many times in your professional practices, you work with someone, but you may not really know what they do. Great opportunity to learn and share. External partnerships, while much of this applies to both practices and educational institutions, my most recent experience has been in educational institutions. And our external partners, for the example, in the last couple of years, is we did not have an opportunity to work with physician assistants. So we reached out to a physician assistance program within our region, not within University of Cincinnati, and developed an event that we could actually have the opportunity for the PA students to learn to the pharmacy students. We've actually tried to develop more pharmacy technician, pharmacy professional engagement because our programs are totally separate. And then IPE organizations. So we recently started within the state of Ohio in the US, a statewide organization for people who are interested in developing relationships that we could build IPE events upon. We also have the opportunity to build bridges based upon a common goal. And networking and identifying common goals can almost be the chicken or the egg phenomenon, because we actually have reached out to people individually to develop rapport, to look at opportunity to build interprofessional education. And in some cases, we've actually identified a common goal and then reached out to people in order to build upon that. In the US, there are national accreditation standards for interprofessional education, and we know that there's some other professional organizations that require that as well, so that we can easily reach out to our allied health professionals to say, we know that you have IPE accreditation standards, we do too, how can we work together? National requirements in other countries also drive interprofessional education. The Institute for Health Improvement developed regional approaches and identified colleges or universities to implement quality improvement programs. And we volunteered for that and reached out and said, hey, we would like to be a part of this quality improvement initiative. We need people from different professions throughout our organization. And we were able to develop an interprofessional team as the result of having that common goal and then pulling people together, using that to really build relationship. Sometimes curricularly, whether it's a teamwork session or communication skills or some type of curricular advancement, have been welcomed opportunities for us to work together. Once you've established some type of connection, relationships and those bridges need maintenance. So in addition to having those initial committees, initial events, you have to really spend time intentionally to learn about the interprofessional roles and training and culture in your colleagues' engagement. One of the most beneficial things that I thought is when we originally developed an interprofessional steering committee, we met physically at each other's college. So I had not been to some of those facilities. I had not been in the College of Nursing in many years. So we physically went and met in each other's institutional buildings. You know, that did a lot for developing some mutual respect. We were all equal. We all respected each other. Really developing faculty development, opportunities for interprofessional research has a way of drawing people in. And then Duke University in the US actually developed an Interprofessional Educator Academy, where it was an opportunity for people to come with their expertise and interest to learn more and contribute significantly. And then the last two really relate to each other, and that is You have to build those relationships, but then develop IPE efforts based upon the resources available. Nothing is more stressful than trying to do something above and beyond your resources, much like a family trying to spend too much money and the stress that it causes in a relationship. So if it's starting with one other profession, one other program, for example, like I said, we're reaching out to the pharmacy technician program to do some more, but we may only be able to do one event. Then add professions later, because we want to be able to have success and not add stress. And then engaging your leadership to enhance these IPE resources really, again, prevents stressful situations and encourages a successful outcome. So in conclusion, developing strong interprofessional relationships is really essential for IPE. It's foundational. It's the thing that you're building upon to develop those great interactions that Nikki described earlier. And then cultivating and sustaining those relations requires intentional and ongoing investment. So it has to be consistent and it has to be intentional. Thank you.
Thank you so much, Jill. That was very well done. And I just want to thank you for identifying that inter and interprofessional activity starts in the classroom at our labs. And it brings together our pharmacy students, our technicians, and our pharmacy assistant students, as well as other members of our healthcare programs. And once we've started enforcing that in our classrooms, what it does is build leaders in the workplace. So thank you again for that. Next slide, please. It gives me great pleasure to introduce our final speaker today, Luis Lourenço. Luis is a community pharmacist from Portugal. He's a member of the Board of Portuguese Pharmaceutical Society and has been serving as the FIP Professional Secretary since 2019. Together with Jill Martin-Boone, he is the co-chair of the FIP Policy Statement on the Interprofessional Working Group. Welcome, Luis.
Thank you so much, Cathy. And well, first and foremost, thank you for the kind invitation that was addressed to me. And on behalf of the FIP Exco and Bureau, thank you for having me here today to just share some thoughts about my own experiences, but specifically not only as community pharmacist, but specifically about my role as professional secretary of FIP. And I also like to address my sincere thank you to Nikki and to Jill for sharing their expertise. I've been taking a lot of notes, so it's always a good opportunity to learn. But as Cathy has mentioned, I've been, well, together with Jill, I've been co-chairing a working group on a statement of policy on behalf of FIP, which is actually the last or the most recent activity that FIP has been involved in regarding interprofessional relationships and interprofessional work. However, FIP has been doing some work on this regard for a couple of years now. And before actually moving forward with my presentation, I'll just like to make a sort of a statement regarding where FIP stands. So FIP stands as an international umbrella organization that involves not only pharmacists, practicing pharmacists, but also pharmaceutical scientists, also the support team, as Cathy has mentioned at her introduction. However, we do not actually have an impact on the regional or local level. We just try to motivate, to collect some information. Well, actually, I was going through the preparation of this presentation. I came up with these three main domains. So FIP works mostly on governance in a way that we do have a position as a representative body. So we try to, within our structure and with other structures, we try to enhance the importance of this intercollaborative or this collaborative practice. The second domain would be related to data collection. Because of our umbrella position, the fact that we are very capillary in the way that we interact with a lot of stakeholders at the regional and national level, it actually makes FIP in a good position, makes it, a valuable resource to actually collect that information and to share with others. And the third domain would relate with policy or with the statements of policy. What you try to do as a representing body is try to keep the best practice, in a way provide guidance so that our member organizations, our individual members at their own practice or at the national level or regional level can actually embrace different topics well, this particular case, we're speaking about a collaborative practice. So regarding governance, what I would like to share with you is that, well, first and foremost, FIP is a founding member of the World Health Profession Alliance. So this is a picture of our last event of the Alliance that was held during the World Health Assembly last May in Geneva. So this organization was formed in 1999. FIP is the founding member right now. Our CEO, Dr. Cathy, actually also the Secretary General of this alliance. And right now, within this structure, we represent more than 41 million healthcare professionals worldwide. It gives actually a position regarding what healthcare professions one stands for. Just for you to have an idea, during this presentation in Geneva, we just emphasize the importance of protecting healthcare professionals, not only the ones that we represent, but all healthcare professionals in situations of war or natural disasters. So in a way, we work as a structure just to lobby for have actually better conditions for our practice, whatever they might be, in a community pharmacy, in a hospital pharmacy, on other practices. So in a way, we actually been working with these organizations, and of course, we do our work close to WHO and to other international organizations, but also the alliance is a good forum for us to interact and to understand, and in a way, just to fulfilling some of the goals or ideas that Sheila just mentioned regarding the establishing of networking, the idea of actually learning from, learning about. So it's a good how you say it, it's a good opportunity to do that. And I'm very happy to share with you that FIP has been invited just to share some thoughts about how pharmacists and other healthcare professionals can be related with the oral medicine. So next September, we'll be attending the the International Federation of Dentists, in order just to share our thoughts in a way, again, learn from, learn about. But of course, we're talking about other professions related, well, other related to the ones that I'm a member of WHPA. However, FIP has also done a job regarding embracing, from the governance point of view, the supporting teams in pharmacies through the creation of the Pharmacy Technicians Advisory Committee. So actually, the committee was, in a way of structuring this first idea that was set in 2011. The Pharmacy Technicians and Support Workforce was established as a domain for the FIP Ed Education Development Team, EAD back then. Things have changed since then, so I just want to keep the focus on 2011. More than 10 years I've been working with allied professionals just within the structure, and now with PTAC, and I will have to also address a word of thank you to Suzanne James. She's not actually here at the panel, but I know she's actually attending the webinar. She's doing an amazing job leading the group, and to be able to actually share with FIP what are the concerns of all the members that the PTAC represents, and in a way also to organize events like this one that we are attending, so we can actually move forward with this connection and interrelation with everyone within the healthcare teams. So when it comes also to how we set our work within FIP, I might like to share with you, probably you have heard about this, back in 2021, FIP has set the FIP development goals. In a way, it's a way of making a structure about what should actually the profession should move forward. And so we have these goals, and one is particularly important, that's number 8, which is working with others. So within each one of these development goals, we have an approach from the practice, science, and education and workforce development point of view. So they have some ideas about where you want to go, as well as some resources. And we also try to collect some examples about what things are working at the local level. So FIP is setting, in a way, a vision and for what we want to achieve regarding this collaborative practice, but at the same time is collecting some examples and practices in case someone would like to apply it, as I mentioned, either nationally, regionally, or in their own practice. So when it comes to the second domain that I came up with, like data collection, I would like just to share some of the publications that have been actually shared by FIP, prepared and shared by FIP of the last few years. We have here 3 of them. That was in 2015 and 2017. The most recent ones in this last 2 on only about the needs assessments. Just This is just for you to have an idea. That's a lot of work that's been going on. Of course, sometimes some of this work is not perceived because, well, there's a lot of things going on, but which is good. But that's why actually we have these webinars to actually know that there's a lot has been done so far, but in a way that you can again collect the best practice, collect the best data that we have nationwide, so that can actually be spread for our member organizations and individual members. So it take me actually to the third and last domain regarding with the statements of policy or policy. So the statements of policy, in a way, it's one of the tools that the FIP has actually to take a stand about a certain topic. We have different statements of policy about different areas of practice, about different subjects relating to the profession. But one I would like to emphasize is the one that was created back in 2010 as the FIP statement of policy collaborative pharmacy practice. So back in the days, more than 10 years ago, 14 years ago more precisely, actually there was a concern from the leadership of FIP that we actually needed to have a policy document on collaborative practice. And just would like to remind you that PTAC was created precisely the year afterwards. So in a way, things are building up all over the years. Then, of course, that our concern was shared also with other healthcare professionals. And in 2013, May 2013, WHPA made the statement on interprofessional collaborative practice that was updated in May 2019. So just so you can have an idea that FIP is also taking a role of moving forward this discussion, trying to keep, well, policy-wise, the most recent or the most updated documents that actually they can be used to have a change in practice at the national level. So what happened is that we had this decade of a lot of work with the awareness, statements of policy, PTAC, WHPA, the statement. However, of course we know that in 2020 we had the pandemic, and then what happened back in Brisbane last year was that there was some discussions about some other statements of policy not really related with intercollaborative practice. It was perceived by our members that it would be important just to have an updated version of our FIP policy statement on interprofessional working, on interprofessional practice. So in a way, that working group was created back then, the idea. Then myself and Jill were able just to have a group of amazing people who has been working about this document. What happens is that we have a draft that actually I want to share with you the outline of all this. But what we came to the conclusion is that it's important because things are being more complex, that of course interprofessional practice is important, but the interprofessional working practice probably needs something more specific. And that's, well, we can actually discuss that a bit later if you want. But so just have an idea that the collaborative practice statement is being updated. The focus right now, it was decided by the working group, would be on interprofessional working, but actually we probably will be one of the conclusions from the council is that probably we need to put some effort on the work related with interprofessional practice, although it might not be that different from what we have right now with the statement of policy, but we do have some details that need to be clarified. So what I want to share with you, and just be aware that this is not the final document, so it's under embargo. I'm not sharing anything which is not appropriate. This is the structure that we have. That doesn't mean that might change in the future. I don't perceive it, but I think the council will actually have it approved. So just to have an idea, this statement of policy is divided in 5 major areas. First, an introduction to give a standard regarding what WHO is standing for, WHPA is also standing for, so in a way to embrace what we have in our international partners. Then we have these topics related to responsibilities. The idea is, of course, to have something aspirational, but it's even inspirational, but also to give some guidance specific to the different stakeholders that are actually reading the document. So we have point number 8 related with the governments and policymakers that together with other health professional organizations should, then it comes to some major points which actually are filled in with ideas about what can be done. Then also there's an area focusing on academia, about education. So as we have seen beforehand, it's important to actually have this involvement of academics in this goal. And then also the role of pharmacists and the way, when we speak about pharmacists, we speak about practitioners, that what should we do on our daily basis. Of course, it's important to have some international standards or international guidance, but what it can actually do to promote the collaborative practice. And then, of course, also take into consideration that this statement of policy is being organized or is being set by FIP, what should be FIP responsibility. So in a nutshell, this is the structure of this document. I hope that in the near future, meaning early September this year, we will have it released. There's just have a sum up of what has been discussed so far. FIP is working in 3 main domains: governance, not only intra-governance, but also inter-governance, data collection and sharing, and policy through their statements of policy. I'm open to any questions that you might have. So, Cathy, thank you so much. I give back the floor to you. Thank you.
Thank you, Luis. It was very informative, and thank you for mentioning that the FIP Pharmacy Technician Advisory Committee has taken a keen interest in the activities of FIP and the work that's being done on inter and interprofessional activities that include the support workforce. And this is also being included in our project that we've been working on through PTAC, that in the Global Competency Framework for Pharmacy Support Workforce. So thank you again for bringing this up, and for the importance of the work that FIP is doing. Thank you so much. And next slide, please. There are a couple of questions, and I see in our question and answer that Jill Martin Boone answered one, and I'm not sure that everybody is able to see that, but the question was, is there any tension of scope that creeps up or is witnessed by the health professionals that overlap? And maybe if you want to talk a little bit more about that, Jill. Your answer is very comprehensive, but thank you so much for responding to that. But maybe you've got another question, another answer or two that you can include.
Well, thank you for saying it's comprehensive. Maybe I should go back and read my. So yes, there is tension between expanding scopes of practice. And I do believe that part of that has to do with the fact that we are not always aware of the growing sophistication of the training of our colleagues. So for example, Nikki, 10, 20 years ago, the things that you are doing would not even have been considered as a potential role for a pharmacy technician, a support personnel in pharmacy. It would not even been considered. And yet I happen to have the privilege of knowing that the training and the expectations has grown to the fact that the time that absolutely the competence is there. And so that it fits much more nicely into the puzzle piece. Much like for clinical pharmacists, 20, 30 years ago, you would be still trying to develop credibility in regards to your clinical expertise to the health profession team. And so absolutely. So what I have observed is that as you develop some credibility, and it doesn't have to just be me. If I have a colleague that's developed credibility in another area and has provided expertise that a physician all of a sudden understands, if I have a pharmacy technician that has shown up and decided to really demonstrate their expertise and has given confidence to other pharmacists, and we've changed laws and we've changed regulations, it lessens the concerns about that scope creep. Plus, the reality is we all have way too much to do. There's a global shortage of healthcare professionals. So as we move forward, my goal when we're in teams is to identify how we put the best puzzle pieces together to do that exact thing about learning from, about, and with, because once that I have an understanding of what you bring to the table, I have confidence. So that's been the model that we've used in order to somewhat lessen it. Is there still tensions? Absolutely. Read a few articles out there in regards to people not wanting other professions to expand their scope. But are we making progress as a whole? Absolutely. And as long as we all come to the table competently, I think that will continue to be the case.
Thank you, Jill. I have a question, and maybe you can answer this one, Nikki. And it's sort of talks about the pushback again from other disciplines and how to handle it. But the maybe you can include how to set up a collaboration between pharmacists and the pharmacy technicians.
Yeah, it has a lot to do with what Jill spoke about as well, of we're all quite understaffed. I feel this is a very common issue in healthcare. So communication to me always seems to be the key, regardless of, if you're a pharmacy technician in the community setting or in a hospital setting, there's more scope that the pharmacists are taking on as well. So if they have more work to do, if there's communication that, there's stuff we can take off your plate and we can work cohesively together for better outcomes for the patient, better running of the pharmacy. Everybody can take on a little bit more and help each other out a little bit better. I think the pushback comes from, everybody's always worried that somebody's coming for their job, right? Oh, if the technicians can do this now, maybe pharmacists and nursing, they can't do it. Are they going to be needed? But we're all valuable pieces to healthcare. And if we can all expand more, it's just going to be better for the patient. So I think working through those growing pains and having your colleagues understand that you're here to help, not to take, sometimes helps a lot with that. So yeah, to me, I would just say communication is always it, making sure the people you're working with know what your scope is, what you can offer, and the things that you can't do that you still need them to provide as well.
Good, thanks, Nikki. And another important point is trust, and I think you alluded to that too, Jill. Is trust and confidence, and in the work that the pharmacy technician or the pharmacy assistant can do to bring that that team together. Louise, I have a question for you. What can participants of this webinar contribute to help FIP further develop inter and interprofessional collaborations?
Well, that's a good question, Cathy, and thank you for actually opening the floor for this, because what we're seeing right now is that when we have good examples or in a way that everyone that's over there, we have roughly 150 participants in this event. I'm not sure if everyone just embrace of collaborative practice, but if each one of them will be able to share a good example of collaborative practice, that will be very important. Because as I mentioned, FIP is working on international level as a sort of umbrella position, but you need to actually fit from what the good examples. And this idea of having good examples is a way of moving forward the collaborative practice. I'll just come back to what Jill has mentioned regarding the tensions, and we see that with other professions. Some of them, my work as professional secretary is also to advocate for pharmacy practice development, not only pharmacy, but also not only pharmacists, but as a pharmacy, not only hospital pharmacy and community pharmacy. And actually, there's a lot of concerns with other healthcare professions regarding if the task that they're doing should be shifting to someone else. But the idea is that some of the tasks are not shifting; they're being shared. So I think it's very important, because with this shortage of healthcare professionals, as Nikki and Jill has mentioned, it's impossible to actually keep on having a good practice to have actually to actually have an answer to the needs of our patients if we don't work and sometimes share some of the tasks. So I'm very much looking forward to receive a couple of ideas or examples of members that are attending this event, or others that you might know from your experience, because that will build up, because you can just advocate and say, you know what, this has been going on in this jurisdiction, and that has been going on in another jurisdiction. Slowly things are evolving in a certain way.
Great, thank you, Louise. Again, this recording of this episode will be made available through www.fip.org. And please provide your feedback to webinars at fip.org so that FIP can continue to improve the digital events. Again, visit events. Again, visit fip.org for all future events, because there are many that are coming up that could include pharmacy technicians and pharmacy assistants and other members of the support workforce. Just another comment. We're almost at the end of our event, and I would like to ask each of our panelists to provide a practical take-home message for our participants listening today. And just to let you know, Louise, there's well over 350 people attending today, so we're hitting a good crowd. So that's
Sorry.
low.
Thank you for sharing. So
It's great. So if maybe Nikki, if you wanted to do a bit of a wrap up and just a bit of a take home message, we'll start with you.
Sure. I think it's very important to advocate for yourself and for your own profession. People will only listen to you if you have something to say, right? So we are all professionals and we provide a great asset to healthcare, right? So but you don't, people, oh, sorry. Again, people don't know what they don't know. So just advocate for yourself, good communication with your pharmacy teams, reach out for, education, things that you can do to expand your scope and take all the opportunities that are available to you, because it ends up really helping with your career and with healthcare for the patient.
Great, thank you. Jill, do you have a comment? You're on mute, Jill.
Sure. Really building upon what Nikki said, I totally echo the importance of advocating for your expertise. And I believe that in one way to do that is continue to build those relationships, really to look at opportunities where you can collaborate, identify those, and obviously from the education perspective, both in regards to the academic setting, where we are really trying to open the eyes of students at a very early level, even before they get into the respective professional schools, but also in practice, providing education about what it is that you can do and respecting and incorporating what it is that other people bring to the table.
Great, and Luis?
So I have my work eased because in a way I will just follow up on what Nikki and Jill has mentioned. But while you are advocating on your daily basis, please be aware that FIP is actually to advocate for everyone. So you have your own examples, you have your own challenges. Please share with them, because what happens is that sometimes what you're doing, it will have a huge effect and a positive effect on another colleague that will be practicing on another area of the globe. And FIP is here to actually do that bridge. Of course, we rely on PTAC to also to help us as in a structure to move forward with that goal. And I think on individual member, that will be the next level after actually our participants doing actually embracing a collaborative practice. Thank you.
Thank you, Luis. Next slide, please. Or actually, we'll stay on this slide. One last note, the 82nd FIP Congress, which is being held in Cape Town, South Africa, is on September the 1st to the 4th of this year. And the Congress will include programs, topics such as equitable quality healthcare, innovative drug discovery and access, and revolutionizing healthcare with AI. And so more information about the Congress can be found on capetown2024.fip.org. Next slide, please. This ends our presentations, and once again, I'd like to thank all of you for attending and for, of course, our brilliant speakers. We've had so many comments in the chat about how this is one of the better ones the better webinars that we've put forward, and I think that people are just interested in how we can share our ideas, our thoughts, our workplace, and to collaborate and to communicate with others in the healthcare profession. So thank you again for being with us, and we'll see you soon. Bye-bye now.